Welcome to the Mid-Yorkshire NHS Hospital introduction video for the new hydration assessment and hydration chart. The hydration assessment has been introduced because, as evidence suggests, healthcare professionals are sometimes unsure of the correct criteria for implementing either a fluid balance or hydration chart. The hydration assessment should be completed by a registrant within 4 hours of a patient being admitted to the unit and once every 24 hours thereafter. Firstly, as per all other trust documentation, ensure patient details are completed correctly in full, including the date. If available, a patient identification label can be used as opposed to handwritten. The hydration assessment requires a registrant to identify the appropriate risk factors that determine whether a patient should have a fluid balance, hydration chart, or no monitoring. From ticking the boxes as seen on the screen, you will be able to work across the assessment, confirming the next most appropriate assessment chart for the patient. From the example on the screen, patient Joe requires a hydration chart because the following risk factors have been identified. He has reduced mobility, he's aged over 75 and has a long-term catheter. Please always ensure registrants completing the assessment form sign the document accordingly, including printing name and designation. The form fully completed should look like this. As identified through the completed assessment, Joe requires a hydration chart. The chart on the screen details the new hydration chart within Mid-Yorkshire. Again, like all other trust documentation, ensure the patient's identification label is completed in full. The hydration chart has 6 sections to complete as seen on the screen. The first section is the drinks and drink type. Each glass represents 200 ml of fluids. All fluid should be recorded when the patient has finished the drink. The drink type can be added in underneath. The second section you can see is for urine. For patients that have no continence problems, one toilet should be crossed off each time they pass urine and the urine colour recorded in accordance to the numbered chart seen at the top of the chart. For patients who have a catheter bag, 250 ml emptied is equivalent to one toilet. For patients who are incontinent, a heavy wet pad would also be equivalent to one toilet. Again, please note the importance of the colour of the urine. The fourth section of the chart is for the food intake of the patient. There are boxes to document what food has been offered, and the circle can then be shaded depending on how much the patient has eaten. To the side of the food amounts column, there is a section for any snacks the patient has consumed throughout the day to also be recorded. The final section is the registrant review. This chart is to be reviewed by a registrant every 12 hours. Remember, if your patient has capacity and is able and happy to do so, you can encourage them to complete the hydration chart independently throughout the day. Thank you for taking the time to watch this video. If you have any further questions regarding the hydration assessment and hydration chart, please contact the Quality and Safety team within the Trust.